Hi, my name is Remy Campbell, and today I will be talking about my institutional pharmacy practice experience at Florida Hospital, Carrollwood. The location of the hospital was on North Del Mabry Highway, Tampa, Florida. The name of my preceptor was Kathy Mormont, and the size of the hospital was 150 beds, and the service they provided included medical surgery, emergency department, adult ICU, antimicrobial stewardship, internal medicine. Some preconception I had about hospital pharmacy going in was that it was mainly clinical focus in comparison to retail, which is correct, and that you required a residency prior to if you wanted to get a job in a hospital. But I've noticed that there were some hospital pharmacists that did not complete a residency and they worked in the hospital. Some expectations I had was that I was going to learn about the pharmacy operations and logistics, the business side of pharmacy in the hospital setting, and I was going to gain hands-on clinical pharmacy practice experience. While at the hospital, some impactful experiences I had was that I developed a report on TXA, blood transfusion and loss, and did a return on investment and a medication use evaluation report. I shadowed a clinical pharmacist while he educated patients on the state of their diabetes. Some duties performed while at the hospital includes, but is not limited to, vancomycin and aminoglycoside dosing, filled cold carts, check stock, and pull stock. My activities vary daily, and our preceptor assigned different projects throughout the rotation experience. This experience has improved my perception of the different roles available to pharmacists in the hospital settings and the type of position that a pharmacist can get within the setting. Uh, I felt like I learned a lot about the role of a pharmacist during this time, and I feel that it would impact me in my future career as a pharmacist and as a member of my community because I got to learn from individuals who went above and beyond when caring for their patients. I also um, got to learn about a great resource such as UpToDate, which helps to guide clinical decision making. Uh, a teachable moment I had while at the hospital was that just like at Northside Hospital from last semester, I went through and did the entire gowning and regowning process, except this time I had uh, a facilitator guided me through the process and was making sure that each step was correct, and if we messed up, we had to start all over again. Some strengths of the site included teamwork. It was a friendly atmosphere, and it was a great learning environment. The preceptors there and the technicians were very receptive to the students, and it really facilitated learning. This experience has increased my awareness of the health administrator role and improved my awareness of how to work towards becoming a healthcare administrator. Dr. Mormon was very helpful and in teaching us how a healthcare administrator um, functions inside the hospital and assigned us tasks that are common to healthcare administrators to improve our learning experience. Um, some areas of improvement that I hope to see would be to increase opportunity to interact with hospital leaders and to increase opportunity to interact with other members of the healthcare team, including physicians and nurses. Um, some recommendations I had would be to schedule at least one activity where students can round with the hospital care team, such as nurses and physicians, and to provide at least one opportunity where students can attend meeting with hospital leaders. Um, Overall, I think my experience was really tremendous. It was really great, and I enjoyed every minute of it. It was hard to find improvements um, because I had such a great experience here. What activity that I wish I was exposed to would be to attend a meeting with hospital leadership. Um, Overall, I felt that the teamwork was great, and I felt very much a part of the healthcare team at Florida Hospital. I was integrated into various work activities to help technicians, as well as working with the pharmacist to help calculate the doses, and also working with my preceptor to learn more about the healthcare administrator role. I felt that I fit into the team there, and it was a great experience. In conclusion, overall, I really enjoyed my experience at Florida Hospital Carrollwood, and I would recommend it to future students. Expectations I had was, as discussed earlier, about the clinical focus of a hospital pharmacist, which was true, and in comparison to retail, and um, the residency required for a hospital pharmacist. While it is nice to have a residency, I found that you can also get a job in hospital without a residency. But I think residency would be beneficial because it would give you an extra year to develop your clinical skills to better serve the patients. Future growth opportunities I would hope to see would be um, to continue to improve awareness about the healthcare administrator role for me personally, because I want to go into that field. And while this hospital provided a great experience with this position, I hope to gain more in the future. And this experience has really taught me a lot about what it takes to be a great administrator in the hospital, courtesy of my uh, preceptor, Dr. Mormon. Thank you for listening, and thank you for your time. Bye bye.